Administrator Joseph Verga knew he wasn't going to have it easy taking on the role as the chief executive officer of the island's only civilian hospital. In the 4 weeks he's been on the job, Verga has been inundated with calls from vendors demanding payment and threatening to cut services and supplies. In fact, just this past week, the Guam Power Authority came intending to cut electricity at the hospital, but Verga managed to avert that with a $174,000 payment on GMH's $300,000 power bill. Then there was the close call with the linen vendor, threatening to stop providing clean bedding for the hospital. Verga managed to ensure delivery would continue with a payment. The constant barrage of emails, phone calls, and letters has Verga trying to get the hospital into fiscal order, but he won't be able to do that without a chief financial officer.
I need someone to really work with them and oversee them and really improve all the billing collection practices and, and really improve things across the board so that I could also be free to be out there and work with other areas that equally need as much attention.
Verga intends to begin interviewing potential CFO candidates as early as this week, as he's working on a plan to stabilize the hospital's finances both in the short and long term to get out of debt and into the black. He stresses, though, that will require commitments from the government of Guam.
So there's a lot of fronts that we're attacking the financial issues on, but there's also other challenges with regards to recruitment of specialized professionals, retention. Salaries here on Guam are not really competitive with those on the mainland, which further compounds the challenges.
In addition to looking for ways to increase efficiency throughout the hospital and realize cost savings wherever possible, Verga says he's also taking an alternate route by seeking rate readjustments based on the populations they serve.
If we can, clearly show, and we clearly can, that our costs, far outweigh, based on our needs, are far outweighed, by an unfair funding methodology, then hopefully we can get those rates adjusted both at the federal and local levels.
The hospital is paid on per diem rates, and the federal government through Medicaid and Medicare reimburse the hospital sometimes only 30 to 40 cents on the dollar, which means the hospital never recovers its cost and never gets out of debt. Verga is also looking at various federal designations that could result in a higher funding mechanism for the hospital. Reporting for Guam's News Network, I'm Mindy Egan.